Hi, and welcome to a programme about biological and targeted disease-modifying anti-rheumatic drugs, or DMARDs. This type of medication may have been prescribed to you if you have rheumatoid arthritis. This treatment tends to be offered to people who haven't seen enough improvement on their initial treatment with conventional DMARDs, such as methotrexate or sulfasalazine. They may also be offered to people who, for whatever reason, cannot take or tolerate conventional DMARDs. Biological and targeted DMARDs are newer forms of treatment that have transformed the way that we treat many diseases, including rheumatoid arthritis. They can reduce inflammation in the joints and slow joint damage, which may help some people with rheumatoid arthritis live an active lifestyle. In this programme, I'm going to walk you through how rheumatoid arthritis affects the body, what biological and targeted DMARDs are, why they may be used to treat people with rheumatoid arthritis, and the possible side effects you need to be aware of if you're starting the medication. I'll also cover how to take your medication and will answer frequently asked questions. Before we look at what biological and targeted DMARDs are, let's have a refresher of what causes the symptoms we see in rheumatoid arthritis. Rheumatoid arthritis typically affects the hands, wrists, knees, ankles and feet. The condition tends to affect the same joints on both sides of your body. Rheumatoid arthritis may affect the small joints in your hands or feet first. They may be stiff, painful and difficult to move. This is because they're inflamed. Let's have a look inside the joint and see what's going on. You're now inside the body. This is what it looks like inside a normal joint. Certain components, such as the synovial fluid and cartilage, work to protect the joint from friction during movement. As you can see, the surface of the bone is smooth and there are only a few immune cells in the joint space patrolling the area. Immune cells normally protect you from infection, but in rheumatoid arthritis they become confused and target your own body by mistake. This is why it's called an autoimmune disease, or in other words, self-immune. If you look around, you can see activated immune cells gathering. These immune cells produce particles that attract more immune cells to the joint and activate them, resulting in a sort of snowball effect. The entire joint has become filled with immune cells. This represents inflammation, which leads to pain, swelling, redness, and warmth in the joint. This gathering of cells and inflammation can wear away the cartilage, tendons, and ligaments. Cells, called osteoclasts, also become too active and they eat away at the bone surface. You can see here how the bone surface changes from smooth to rough. Over time, this can cause joint damage. So, in summary, your immune cells are responsible for the symptoms of rheumatoid arthritis, meaning that you may feel a throbbing and aching pain, particularly in the mornings or after sitting down for a while. Your joints may feel stiff or difficult to bend, and your joints could be tender to touch and feel a little hot. By reducing the activity of your immune cells, you may be able to control your condition better. Biological DMARDs are drugs made from substances produced by the body. They were first used in common clinical practice in the mid-2000s and have transformed the way we care for a number of diseases, including rheumatoid arthritis. Targeted DMARDs are not made from the same substances, but they do work in a similar way to biological DMARDs. They came about more recently and, like biological DMARDs, have been proven to be effective in treating rheumatoid arthritis. The general aim of biological or targeted DMARD therapy in rheumatoid arthritis is to calm your immune system so it stops attacking the tissues in your joints. Most people with rheumatoid arthritis start medication with conventional DMARDs, which are disease-modifying anti-rheumatic drugs, such as methotrexate, sulfasalazine, leflunomide and hydroxychloroquine. Some people can't take conventional DMARDs due to side effects, for example, and some people don't see enough improvement in their symptoms and need to try something new. These people may be able to take a biological or targeted DMARD instead, or, most likely, in combination with a conventional DMARD. To explain the difference, think of inflammation in a joint like a leaky pipe. Conventional DMARDs are equivalent to using cloth to mend a leak in a pipe. It can be effective, but sometimes it isn't enough to stop the damage. Biological and targeted DMARDs are like turning off the water supply to the specific pipe that is leaking to stop the damage. So conventional DMARDs do work to reduce inflammation, but biological and targeted DMARDs work in a more precise way. By calming down inflammation in your joints, they can help slow joint damage. In some cases, they can stop progression of the disease. As with any medication, there may be side effects from treatment with biological or targeted DMARDs that you should be aware of. How you receive your medication depends on what type you've been prescribed. Your healthcare provider will let you know how to take your medication, and you must follow the instructions that they give to you. There are 3 different ways you may be given a biological DMARD for rheumatoid arthritis. Using an auto-injector pen, using a pre-filled syringe, and by drip, which means it is given directly into your vein, usually at a hospital or clinic. There is another type of therapy called a targeted DMARD, which is taken by tablet. Many biological DMARDs can be given by injection via a pre-filled syringe. This will be given by your healthcare provider initially, but you can be trained to do it at home. Firstly, an injection site needs to be chosen. For example, the lower tummy or inner thigh, and the area must be cleaned with an alcohol wipe. The syringe needs to be held at a 45-degree angle to the skin. The needle is then placed into the skin. The medication is injected, which may take up to 10 seconds, and the process is finished. Depending on the type of medication, you may have to have an infusion the first time you have it. Please note that this demonstration does not replace training for use at home. It's for illustrative purposes only. Please talk to your healthcare provider about taking your medication. You're now in the frequently asked questions section. Find out more about the topics displayed here by clicking on one of the icons. You can also visit the Versus Arthritis website to find support for people living with rheumatoid arthritis, such as managing your condition, treatments, and a helpline you can call.